Welcome back to the channel. Thanks for joining here at Unapologetically Progressive. Now, this is going to be an update to that previous video about RFK Jr. changing the COVID-19 vaccination recommendations from the CDC and the FDA. And it turns out he did this with absolutely zero scientific evidence. No scientific research was done at all for him to come to this conclusion. I took a little bit of time to do some research, and in this article that we're going to talk about will highlight that as well. But before we get into this article, I want to talk about the person that said I should be embarrassed for the information that I gave in that previous video, making as if I'm just some idiot that just doesn't know better, right? That just doesn't know how things work. Well, here's the thing. I may not be a scientist. I may not be a doctor. But the one thing I have done over the last 15 years is read study after study about vaccinations, which vaccines are good for people, which vaccines are bad for people, how the COVID-19 vaccine works, right? How the mRNA vaccine is not a new thing, but it's just something that's been being studied since the 80s, if not before. But you see, since 2010, roughly it was, right around the swine flu outbreak, I was informed by the people that take care of people like me, as in the Muscular Dystrophy Association, that I needed to get vaccinated because the swine flu in particular could kill me. I had a doctor who demanded that I get vaccinated, or else he was scared that I was going to die. So I was one of the first ones at my university to get the swine flu vaccine. Literally, they opened at 8. I got my shot by 8:25. Because I did research on the swine flu vaccine and the improvements done to it from the 70s until the time that it was needed again in 2009, 2010. There's a reason that I do what I do. It's not just because it may help somebody, but it's because it helps me, right? I discuss people getting vaccinated every year, right around flu season, almost every year, for the same reasons. And I am not embarrassed to give you the facts and the information that I find from studies, research, and interviews with scientists and medical professionals who know what the hell they're talking about. So to think I should be embarrassed for that is insane. The person who should be embarrassed for speaking is the man with a 14-year heroin addiction who called it good to be a heroin addict and who had a brain-eating worm eat his brain, and he thought that was good for him too. Maybe I'm not the one that needs to be embarrassed. Maybe it's RFK Jr. Maybe it's him who's embarrassing. But these are things he has said. Yeah, he wants to tell me and tell the entire world that being a heroin addict is okay, but getting a COVID-19 vaccine, if you're under the age of 65 and healthy, is unreasonable. But let's get into this article, right? Enough with the tomfoolery there, I guess you could say. Want a COVID vaccine? It could cost you $200, says this article from USA Today. The Trump administration COVID-19 policy changes mean anyone who is healthy and under the age of 65 likely would have to pay out of pocket, including pregnant women and anybody trying to help a child not get this illness. Even though it goes on to say here, most Americans have decided that they're done getting vaccinated against COVID-19, which is a reasonable choice because for some people it is not as dire of a situation as it is for others. I believe we should still be allowed to make our own decisions, and I don't believe the government should prevent us from being able to access that. And now, here in a minute, we're going to talk about exactly why these recommendations will affect other people. But it says most Americans have decided they're done getting vaccinated against COVID-19, but there are still reasons to consider it and remains essential protection for some people. That is why some doctors and medical organizations are concerned about the changes to the recommendations made by the Health Secretary Robert F. Kennedy Jr. Under the changes Kennedy announced on social media on May 27th, in addition to those announced the week prior by his appointees, the only people who will be recommended to get the COVID-19 vaccine are people that are over the age of 65 or people with existing health conditions. So that right there tells you a lot, right? That alone is a problem. And we'll get into it as we get down this article about how this is important and why. But as it is, this is going to curtail a lot of people from getting the COVID vaccine. You're going to see these numbers start to go up even more than they already have been. And things are probably going to be fine during the summer. When we get to the fall, when people aren't being able to get vaccinated again, you're going to have more people dying in the hospitals, more people going to the hospitals than you were before. We're one of the only countries that's doing away with this for the majority of its population, to be clear. Let's get back to the article. These changes, which bypass normal scientific review process, may make it harder for others who want the COVID-19 vaccine to get it, including healthcare workers, healthy people under the age of 65 with vulnerable family members, and those who want to reduce their short-term risk of the infection. Kennedy specifically changed recommendations so pregnant women and healthy children aren't included, though it's not clear if this is just for booster shots or whether it would also prevent or include a baby's first COVID vaccine. See, and there's the other problem with the Trump administration. They don't ever do anything on a basis that actually gives you all the information. They leave it so murky and so, so out of source that you don't know exactly what's going on. It's what they keep doing. It's what they've been doing since Trump took office on January 20th. Now, this is where it comes into play about what would happen to people on insurance. Insurance coverage typically follows federal recommendations, so anyone who is healthy under the age of 65 would likely have to pay out of pocket to get the vaccine, which runs about $200 if they can get it at all. It's not clear what insurance companies will do about the current or the new recommendations. Kennedy did not explain the reasoning behind the change, though he has complained in the past about the guidance or the quality of studies used to justify previous recommendations, when his recommendations provided no scientific reasoning behind it. Limiting access in this way, several medical experts said, contradicts Kennedy's previous statements about how he'd handle vaccines. It also runs counter to the general practice of medicine, which supports people making medical decisions in collaboration with their doctor, not the government, right? Goes on here, says, I think we can treat people respectfully and show them the information and let them make their own decisions, said Dr. Jesse Goodman, a professor of medicine and infectious diseases at Georgetown University. See, those are, like I mentioned earlier, scientists and medical professionals that study this stuff say this is a stupid idea and a bad idea and a bad path to take, right? These are people that know what they're talking about, people that have studied this and have doctorates in this study and have for decades. He and others said they are especially concerned with these policy changes are happening without supporting data or typical scientific review by two panels of experts. We haven't been presented with one shred of information that shows this step is needed at this time. If it is, fine, but present that publicly. use the advisory committees, and let's have a transparent process. Who still needs the vaccine? The federal government has stopped tracking COVID infections and hospitalizations and death, but local data shows they are still happening in every age group, with 2/3 of hospitalizations being people that are 65 years and older, which is continuing to be the same thing that it's been since COVID was a thing, right? People that are over 65 are at higher risk, but also they're at higher risk when people around them are not vaccinated. We saw that before the vaccines came around, how kids that came home from spring break and stuff like that, and their parents started dropping like flies, especially those that had parents that were in their late 60s, right? There were people, lots of younger people came back and had that infection, and they didn't even know they had it. But people who were 65 and older and immunocompromised were dead, and you can't tell me they weren't. The numbers show over 1 million Americans died of COVID-19. Most of them were elderly. Many of them, when you did the tracing, went back to a younger individual who didn't even know they had it. So this shows you how important these vaccines can be for people. And the fact that they don't put that in the guidance is insane, because people deserve to be able to make their own decisions about their own medical care. It's not the government's decision to tell you what you can and can't have done and what you can and can't take to protect yourself. Meanwhile, safety data on vaccines continue to show that serious side effects are extremely rare, leading many specialists and experts organizations to conclude that they're still worthwhile to get the vaccine. Um, Let me scroll down a little further. While the vaccine is most important for people that are in vulnerable groups, such as people over the age of 65 and people with health conditions, boosters remain useful for every person, even children, several experts and disease organizations told USA Today. What is clear is that pregnant women, infants, and young children are at higher risk of hospitalization from COVID-19, just as I mentioned earlier in the previous video. And safety of the COVID vaccine has been widely demonstrated, according to Dr. Sean O'Leary, chair of the American Academy of Pediatrics Committee of on Infectious Diseases, said in a statement. Let me reread that for you. Let me reread his quote for you. What is clear is that pregnant women, infants, and young children are at higher risk of hospitalization from COVID-19, and the safety of the COVID vaccine has been widely demonstrated. Now, why would he say that? Well, that's because the COVID-19 vaccine was one of the most widely given vaccines in our history since the polio vaccine. That's how serious COVID was at the time. And a lot of people seem to have a short memory of those icebox trucks sitting outside of morgues because thousands of people were dying. Hundreds of people were dying a day, right? And thousands a week, right? It was really, really bad. And you got people out here like RFK Jr. and that person that comment earlier that seem to not understand that. They seem to totally forget how bad things got, right? And I don't blame any one politician for it, for how bad it got, right? Should children get the COVID vaccine? Healthy kids will no longer be recommended for COVID-19 vaccines, according to Kennedy's policy. Fewer than 5% of children received COVID-19 vaccine between fall of 2023 and the fall of 2024, according to data. Yet COVID-19 continues to lead to about as many hospitalizations in children as it does flu, right? It says about 100 hospitalizations for every 100,000 kids. Well, 100 hospitalizations per 100,000 kids under the age of 4. On balance, the vaccine still provides a benefit, Dr. Melissa Stockwell, Division Chief of Child and Adolescent Health, Columbia University. The point of a booster is to give protection against whatever current variant is circulating, and in the shorter term protection against infection. But what we're really looking at is protection against severe outcomes. And that's what I've been saying ever since the vaccine came about. Just trying to point out consistencies in my reporting here on the channel for the last 5 years. The COVID-19 vaccine has repeatedly been found to be safe in children, though vaccines, like any medication, can always have some rare risk. Most notably, with the original COVID-19 vaccine schedule, adolescent boys and young men were somewhat at higher risk for a rare heart problem known as myocarditis. That is also a risk of COVID infection itself. Stockwell said she and others haven't seen myocarditis since the early days of the vaccinations, when the initial 2 doses were given relatively close together. Now, that was something I reported on a few years ago about the COVID vaccine, about teens getting myocarditis, and it having to do exactly with the dosaging not being separated out far enough, right? Because that's back when we were doing double the dose. You had to get a vaccine, and then a few weeks later, you went back and got another vaccine. For teens, that appeared to be, especially teen males, that appeared to be a problem because of the stress and the inflammation caused. Therefore, the myocarditis became an issue. But that has been very rare to see. What remains unclear, and much of higher concern to pediatricians and infectious disease experts, is whether Kennedy's new policy covers all shots or just boosters. Children between 6 months and 2 years are at high risk for severe COVID-19 because they have not been exposed to it before, just like everyone who is at higher risk when the virus was new. And vaccination reduces the risk for long COVID, which I mentioned in my previous video and other videos I have posted before, in which symptoms can linger for months, if not years, after a COVID infection. Stockwell, who said her own children are vaccinated, cited research showing that vaccines reduce the risk of long COVID in children by 40%. So do I really need to be embarrassed about the content that I provided in my last video? You be the judge of that. Tell me in the comments what you think. Also, let me know if you think I've been consistent on this issue for the last 5 years in my coverage of the COVID-19 outbreak, the vaccines, and the prognosis of the pandemic that we went through. A new study from the JAMA Pediatrics shows that children younger than 2 years old who have been infected with COVID were more likely to experience trouble sleeping, fussiness, poor appetite, stuffy noses, and cough, while preschoolers aged 3 to 5 who had been infected were more likely to have low energy, daytime tiredness, and a dry cough than children who avoided infection entirely. Now, the study found that roughly 1 in 7 previously infected children meet the criteria for long COVID. For parents with children who have been who want their children to be vaccinated, we want them to have that opportunity. Sorry for all the coughing. I've been sick myself. Is it risky to skip COVID-19 vaccine during pregnancy? The new policy removes recommendations for COVID-19 vaccination during pregnancy. This concerns a number of obstetricians, infectious disease specialists, and pediatricians alike. Pregnant women are at high risk for severe disease. Studies show that the likelihood of a miscarriage, stillbirth, or pregnancy complications like preeclampsia, blood clots, heart and kidney damage, and hypertension are much higher among women who develop COVID-19 during pregnancy. Newborns are also at a higher risk of severe outcomes from COVID-19. Any respiratory infection that is dangerous to newborns uh, than in, or more dangerous in newborns than in others because their airways are smaller, plus they've never been exposed to COVID-19 before. Vaccinating during pregnancy protects newborns until they are old enough to get their own shot, according to Stockwell. The COVID-19 vaccine has also been shown to be extremely safe during pregnancy, far safer than COVID-19 itself. The Society for Maternal Fetal Medicine, which has expertise in high-risk pregnancy, issued a statement saying the society strongly reaffirms its recommendation that pregnant women receive the COVID-19 vaccine. The COVID-19 vaccine, the society said, is safe to be given at any point during pregnancy. Maternal immunization is also associated with improved infant outcomes and decreased complications, including maternal and infant hospitalizations due to COVID. Now, we're going to cover the rest of this in another video. We'll start right here with this process. We're discussing the process of changing the vaccine recommendations. And we'll start with that in the next video. But now here's the thing that people aren't seeming to understand. COVID vaccines are not dangerous. Overall, they are safe. It's very rare for them to have a bad reaction. Now, very rarely, like all medications, very rarely there can be some side effects. Typically, those side effects are not as bad as getting COVID-19 itself. If you're one of those people out there that believe I should be embarrassed, then you're the one that needs to be embarrassed. Because I just read you what actual scientists and experts in the field of pandemics and infectious disease had to say about this vaccine. And how all of these people are coming out against RFK's recommendations, especially given the fact that it went under no scientific review at all. RFK Jr. wants to complain that he didn't feel that COVID-19 was given a rigorous enough, research before it was, given to the public, blah, 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 right? Yet his own recommendations are not based in science. The COVID vaccine itself is based in science and has been being studied for decades. Not necessarily the COVID vaccine itself, but the platform in which it is created. The platform, using the mRNA platform to create the COVID vaccine. That platform has been being studied for over 30 years and it has shown to be very effective. Not only has it shown to be effective in helping create COVID vaccines in a manner so quick that we'd never seen that kind of turnaround from absolutely nothing to having a good vaccine. Right? We'd never seen that. The last time we saw a vaccine get turned around that quick was at the start of the swine flu epidemic that they were having, or it was, I don't know if it was an epidemic or not. I know it never really got all that. It didn't get all that far because people got vaccinated pretty quick. Why did people get vaccinated pretty quick? Because we already had a swine flu vaccine that we had made before. We knew how to make it. We knew exactly what to do. COVID-19 was completely new. We did not have a vaccine. And so they had to start from scratch. And thanks to the mRNA vaccine platform, we were able to make and get out millions of doses of vaccine in short order, in like not less than 9 months, if I recall. And if you go back and look at my reporting on that, I gave Donald Trump a lot of credit for the creation or getting the funding, not because he made it, but because his funding and his funding push for Warp Speed put the funds necessary for them to work around the clock to get that out. And it saved millions of lives since. But no, I'm not embarrassed of my previous coverage of this of the pandemic and COVID-19 vaccinations. Definitely not embarrassed of my last video. Anyhow, y'all have a great day. I'll see you down the road.